So with ECU injuries, so repetitive sporting activities often leads to the development of tenosynovitis. So the ECU tendon sheath can be irritated by repetitive flexion and extension of the wrist. So tendinopathy is thought to be an adaptive process of the tendon to repetitive stress and/or trauma, and may progress through different stages. So there's reactive tendinopathy, tendon disrepair, and degenerative tendinopathy. And then you've also got tendon instability, which can vary from minor subluxation of the ECU during rotational movements to dislocation and forearm locking. Then you have the disruption of the subsheath of the ECU, so the tendon doesn't remain sitting in its natural groove. So you can see here the mechanism of injury. In certain sports, you can see in this picture, he's in ulnar deviation, wrist flexion, and slight supination. So it's quite common with rugby and football, also water polo, when patients are holding their hand in that flexed, ulnarly deviated position. So these patients commonly report ulnar side of wrist pain, and you can sometimes physically see a snapping of the ECU tendon. So it's important for wrist extension and ulnar deviation, but also in providing stability to the ulnar side of the wrist. So its position changes with forearm supination and pronation. Therefore, it needs to be mobile yet stable. So we'll just play that video one more time. So you can see here, you can physically see that flicking of the ECU tendon as the forearm is rotated. So the ECU synergy test is useful for detecting tendinitis, whereas active contraction of the ECU, you can observe the snapping of the tendon as it leaves the groove. Treatment. Conservative management of ECU injuries would involve the Munster splint to prevent forearm rotation. So it's basically trying to rest the tendon. You can see in this picture in surgery that tendon has been relocated and stabilised, so it is no longer subluxing as that patient rotates.